Hello, it's time for another CCO Club webinar. We're at number 122. This is where we answer our club members' questions and do research for you, kind of unpack scenarios that you might be struggling with. We have both students in our club, so new people to coding, as well as people who are established and working in all different areas and with different credentials. Today is a question that had come in regarding vaccinations. They wanted to know a little bit more about the difference between coding for pediatric versus adult vaccinations. Now, there is a lot of changes that happen with vaccination coding. We could do lectures on this a couple times a year probably, but we're going to kind of look at it from a broad perspective. I'm going to give you some information on things that you need to know before you go and code for vaccinations. Let's talk about the considerations first. For pediatric codes, the first thing is that they are age-specific codes. In the description, you're going to have an age range. Most of the time with pediatric vaccination codes, there's also a series of uh, vaccines that happen, or a series of codes. There is often combination vaccines, and you want to be very mindful of that. Whenever you're giving children vaccine, almost always counseling will go along with that. So vaccine administration counseling will be a consideration, as well as has the child gotten all of their vaccinations? Are they up to date, or are they incomplete vaccinations? Versus adult vaccinations. Well, those are age neutral codes, so they don't have ages, like a pneumococcal vaccine doesn't have an age appended to it. Vaccine type, emphasis for the description of the code that you'll use. Also, there's an area for high risk category codes, and with adults, often you'll see booster shots and revaccination uh, occurrences happening. And then there's another little area for travel vaccination. So if you're going to go on vacation and you're going to go to another country, you can ask your provider, are there specific vaccinations I need to be able to go to? And then you list the country you're going to, and then they can look that up and give you the appropriate vaccinations for that area. So again, these are all things that you need to consider when you look at coding for vaccinations. A lot of times when we first start learning about vaccination codes, we focus in on child vaccinations. And again, like I said before, those are kind of fluid. They're always changing a little bit. What the criteria is for recommendations for when you get a specific vaccination, what age or what stage in your vaccination schedule, et cetera. By the time, sometimes you were given them at birth, sometimes, then you're certain months of age, and then they get into years, and it can be very, very confusing. And again, those are often combination vaccinations. We'll talk about those. Breaking down the description a little more regarding those considerations, we're going to start with the pediatric vaccination codes first. So age-specific codes, we are using CPT codes that correspond specifically to the child's age, and this is going to help with the billing and making sure that you're accurate for the appropriate vaccination based on the child's age. I'll show you examples of that. So if you have a child that has to have their MMR at a specific age, then that's what you're narrowing down on, and that's why you're using that specific code. And then you have sometimes where a child isn't given the code or the vaccination at the right time. That also makes a difference. The vaccine series codes, they're administered as a series and at specific intervals. This is where I was saying it can be somewhat fluid because the I have a child. My oldest child is in his early 30s. My youngest child just turned will be 17, or he is 17 now. Think about it for a second. So that big age range, the vaccinations that they got as a over 30-year-old when he was a child, or and even when he was born, is different than the vaccination that my youngest got. And then, of course, the age ranges in between. There's 5 years between the first. I've got 6, so the first 3 had 5 years between them, and that, was always different every time I was going in. And then there was a time where we didn't vaccinate because of health issues of the child. They were postponed, and so, uh, that will cause a lot of, there's a big knowledge gap on when to do vaccinations, which vaccinations at what time. The ones who are the experts at this are pediatric nurses. So your family practitioner, they're kind of on top of it, but the pediatrician and the pediatric nurses, they have the schedule for the vaccinations because they're the ones that give it the most. And they always are up to date. So if you ever have any questions or concerns, that's who you go to make sure that you're getting the proper code. Those combination vaccines, some of those will be multiple antigens in a single shot, or you'll have individual multiple shots on the same day that are combinations. Um, those require knowledge of the individual components as well as the codes that are associated to them. We don't just code for what's going into the body. We also code for the administration of the vaccination. So first the stick, then the substance. With vaccine administration, that's kind of a segue, the often involve additional time for counseling, especially in today's age when everybody's concerned about vaccinations, or we hear so many people talking about vaccination. uh, my daughter, she has 7 children, and they don't do vaccinations. And again, my other child that has 2 children, they do vaccinations, and they do it for different reasons and health concerns and stuff. However, that means that when they go to their doctor, they and the pediatrician, that pediatrician is counseling them on the pros and cons uh, regarding specific vaccinations, why you would or would not get them, and answering any questions or alleviating fears for doing or not doing the vaccinations. So counseling services could be coded separately within the E&M codes. Now, if you have incomplete vaccinations, if the child only gets so many vaccinations uh, for through a series, then you have to really be accurate and indicate which doses had been administered when, and be very aware of pending, and make sure the documentation and the billing is done accurately. I had 2 children out of the 6 that had health issues that prevented them from getting a lot of series of their vaccinations. And so, and again, you don't give vaccinations when a child is sick. They have a fever and stuff. So that can delay vaccinations. And just be very mindful that when you go in and you read the encounters, that you're on top of incomplete vaccinations and the counseling services that go along with that, as well as combination vaccines that are given to these children. For adult vaccinations, honestly, it's a lot easier with adults. They're age neutral. It doesn't matter what age the adult is getting the vaccine. It can be across the board from 18 on. It just simplifies everything to not have to be tied down to a specific age range like pediatric vaccinations. Also, the vaccine type is the emphasis with adult vaccination. So, what are you giving them? Most of the time, we're going to be looking at things like flu shots. The seasonal flu shots are they're different. So 1 year you're getting a combination of flu shots, which will have a name that the nurse will put down when she gives the injection. And then the next year, they'll come in for their flu shot. Well, it'll be a completely different substance. And I can't remember how many strains of flu that they give you each year, but for one, it's like between 3 and 7. I can't remember off the top of my head. If you know, you could put it in the chat or just check yourself. There's pneumonia, pneumococcal uh, type vaccinations. There's now hepatitis. They now have varicella that they give to children, which is chickenpox. But I believe as an adult, if you never had chickenpox, then I don't know if you get the varicella or they just go ahead and give you a shingles shot. But you get shingles is a type of chickenpox. So it's either varicella or the shingles shot. I don't know the difference in those. You may be more familiar with that. But again, understanding what the vaccine is going to allow you to code to the highest specificity when you deal with adult vaccination codes. We also look at high risk category codes with some patients that are adults that have chronic illnesses or they're immunocompromised, immunosuppressive diagnoses that they have. Vaccines may fall in a high risk category. So you have to ensure that you're accurately coding to reflect the patient's vulnerability for specific vaccines that are provided. Now, don't think that you're coming up with that information. It is documented for you. Just know that there are codes available to translate that properly and be aware that high risk category codes are in the code set specifically for these scenarios so that you don't miss that. Booster shots and revaccinations, uh, we know that even if we give COVID as an example, that's multiple boosters. I mean, I don't know, are they like in 4 boosters they were given out? I can't even remember. And it's over a certain period of time. Be aware that there's a recommended schedule for booster shots, and the vaccines have appropriate CPT codes for subsequent doses. That's what a booster would be classified as a subsequent dose. Now, for those travel vaccinations, pretty simple. Just know that these are codes that are related to going to specific areas. You're not going to get a malaria vaccine or vaccination unless you're going somewhere where you could get malaria. In other words, you're not going to go to your annual wellness visit and have a vaccination for malaria on the list. Just a quick little commercial break here, guys. If you are not part of the CCO Club, it is a fabulous place to get content like this. We give you complete replays of the lectures. You get the slide deck, the transcripts. We continue to have discussions. If I say, like I did a few moments ago, I don't even remember what country you would go to get a malaria shot, or what is the flu variant, or how many variants of the flu are in each flu shot in a given year. That's where we discuss that, as well as scenarios that pop up in our everyday coding lives, where we have people of all skill levels within the industry talking and discussing in the CCO Club. If you want to be a part of the CCO Club, real nominal fee, you can go to cco.us/club. And just so you know, we are giving out this content up to a point free. This will stay up, but after this commercial break, the rest of the content will no longer be live. You'll have to get it in the CCO Club. And we're about to talk about the specific vaccination codes as well as documentation that's needed for those codes next. If you want that content, then go to the cco.us/club and join.